All right, thanks again, Kristen. So good afternoon, everyone. Like Kristen said, my name is Ashley Alfonso, and I am a Quality Improvement Project Manager here at HealthNet. Leticia Barrett and Matt Anderson from the team are on the call as well. This is our first time presenting on member experience here on the Wellness webinar platform, so we're really excited to be here with you all today. For those of you, if this is the first time hearing about member experience, we really hope that you find today's presentation informative. So if any questions, comments, or thoughts come up, we very much encourage you to use that chat function that Kristen just mentioned and type them in, and we'll be sure to address those at the end of the presentation. Okay. So let's go ahead and get started. So this slide shows just an overview of what we'll be covering today. A better understanding of what member experience really is, ways you can provide feedback with a particular focus on the member experience survey, the CAHPS survey. We'll go over, the survey and why it's important, what does the survey measure, and how the results are used. Again, we've allotted time at the end to answer any questions. So again, use that chat function and we'll be sure to go over those at the end. All right, so I'm sure many of you have heard the phrase customer experience used by many major retailers, companies, and organizations that you engage with. Member experience is similar, but specifically refers to the interactions that you have with your healthcare system, as well as aspects of healthcare delivery. So some healthcare system examples include care from doctors, nurses, hospitals, and other care facilities. As for aspects of healthcare delivery, some key examples include access to timely appointments. How easy was it for you to get the information you were seeking? Communication with your doctors and clinic staff, and how healthcare personnel were treating you during those interactions. Before moving on, I do want to highlight the two terms, member experience and patient experience. Essentially, they're one and the same. Which wording you use just depends on the setting that you're in. Member experience is used really in the context of the health plan space, while patient experience, you'll hear that more used in a doctor's office setting. So we just went over member experience, but what about member satisfaction? Although some think that they are interchangeable, member satisfaction is actually different from member experience. Member satisfaction measures whether one's expectations were met during a healthcare encounter. While member experience, specifically the member experience survey that we're talking about today, it focuses on capturing member feedback around one's healthcare interactions. So with the survey, we are trying to gather from you, the member, firsthand on whether something that should have happened during the healthcare encounter actually did happen, and in some cases, how often it took place. We'll go over some examples of this in the upcoming slides. Okay, there we go. So before I dive deeper into the CAHPS member experience survey, I also wanted to highlight other ways where you, the member or patient, can provide your feedback and input. One main example is a satisfaction survey that you receive after wrapping up your appointment at your doctor's office. Simply sharing your feedback directly with your doctor or clinic staff is also another more direct method. Additional ways include getting sent a feedback survey a few days after your appointment or staff interaction, such as when you called in with a question to your health plan call center or a phone check-in with a case manager. More recently, we're also seeing a growing trend in online feedback. I'm sure most of you have heard or used one of the popular online platforms where you can post and read reviews, the Yelps, the Googles, the Nextdoors, just to name a few. Social media platforms are also becoming another source to see or hear which clinics or types of care others out there are also receiving. Additional forms of online reviews, such as clinic websites, are also available for online users to check out and read those reviews. For the purposes of today's presentation, we'll focus on a specific member experience survey, the CAHPS survey, and why it should matter to you. So what exactly is the CAHPS survey, and what does CAHPS even stand for? So CAHPS stands for the Consumer Assessment of Healthcare Providers and Systems Survey. It is a regulatory survey that is mailed out to a random sample of members in the spring of each year. If you receive a notice in the mail asking for your participation in the CAHPS survey, all the appropriate details and instructions will be included, so you'll know exactly what to do. The survey is about 40 to 50 questions long and takes members about 15 minutes to complete. Results are completely anonymous and used to ID areas of focus for improvement efforts at both the health plan and provider office level. So the healthcare field is constantly evolving. So it's crucial for us here at the health plan to know if your healthcare priorities have also changed. Getting your feedback firsthand will let us know what really matters to you and your family. Here at the health plan, we want to be able to, to dissect the results from the survey, highlight trends among the responses, so that we can really get to the root cause of what may have caused either satisfaction or dissatisfaction. Basically, we just want to improve, and we won't know where to focus our efforts without your input. A reminder that the results are completely anonymous, but if you are chosen, your feedback will represent thousands of members just like you. So how does the CAHPS survey measure member experience? Like I had mentioned, the survey is comprised of 40 to 50 questions, and these will revolve around various healthcare topics. The survey asks questions on areas that members say are important to them. And so some examples are listed on the slide here. So getting appointments and care needed, how well the health plan paid claims, care coordination, and how you rate your health plan doctor and specialist. Again, survey responses are kept anonymous, and they are returned to the health plan for additional analysis. So next on the slide, we've pulled together examples of questions you would see on the actual survey itself, and which specific CAHPS measure it pertains to. So for the getting appointments and care needed measure, the question you'd see on the actual CAHPS survey is, how often was it easy for you to get the care, tests, or treatment needed? For the customer service measure, how often did your health plan's customer service treat you with courtesy and respect? For the paid claims measure, how often did your health plan handle your claims correctly? The care coordination measure, how often did your personal doctor seem informed and up to date about the care you got from other healthcare providers? Rate your health plan, rate your doctor and your specialist. Questions will ask you, to rate each of these on a scale from 1 to 10. In addition to, if your provider, your healthcare provider, how carefully did they actually listen to you? Did they spend enough time with you? There is also a CAHPS measure around the flu shot, just trying to gauge if you had gotten your flu shot within the last year. As you can see, your responses can really help pinpoint specific areas where, we're doing well, and again, areas that need improvement. So now, how are the results to use? The health plan analyzes the results to identify trends and key findings around areas that stood out most to members. Again, really specifying areas on where we did great, as well as areas we need to work on. We also want to make sure our findings and stakeholder departments and the provider offices that we work with, that they're also kept in the loop of what our members had to say. We collectively work together with these folks and teams and clinics to highlight areas where we can do better on and create improvement plans to best address our member and patient needs. This also helps us really concentrate our efforts and resources on areas that really matter to you most. Lastly, CAHPS results are made publicly available so that members can see how their health plan performed in comparison to others. So, positive member experience can lead to improved clinical outcomes and overall care. Here at HealthNet, not only do we want you to have a positive experience with your healthcare, but we also want to make sure that you are healthy. And staying up to date and engaged with your healthcare can really play a big role in that. Those who are happy and satisfied with their care that they receive will have a higher chance of staying engaged with their healthcare down the road. So we really do want to serve you in the best way possible. We need your help to identify areas that we need to improve on, so it really does become a partnership between members and their health plan. We truly value your honest feedback, and through the CAHPS survey, you can help let us know how to best serve you. What you think matters to us, and we will continue our work to improve so that you're always satisfied with your care experience. So that is the end of my my section of the slideshow today. Short and sweet. I hope this was a great introduction into the CAHPS member experience survey for all of you. And now I will go into the Q&A portion. If any questions, comments, or thoughts around anything that I had went over today, go ahead and type those into the chat box, and then I think Kristen will go ahead and read those off because I think everyone's muted.
Yes, thank you, Ashley, and thank you so much for this valuable information you presented today. As you mentioned, participants today, if you have any questions, please go ahead and chat me. I'll give it a few seconds here. There are a few more slides that I will cover now, and I do see a chat right now. Great, okay. What happens with complaints about my doctor or compliments?
Great question. So I think, okay, I'll speak. I think it'll depend on, the platform that you're expressing your feedback on. So if, so on that last, on one of the slides, I had gone over the ways that you can provide feedback. And so I think depending on the platform that you use, it'll go to the appropriate folks. For the CAHPS survey, since we're talking about the CAHPS survey itself for today's presentation, I know in the CAHPS survey, we do get those results. Again, those are anonymous. And then, if there's any verbatim comments, we do get a copy of that, and we do take that into account as we plan for our improvement plans, not only with the health plan, but with our partner provider offices, and we definitely take those into account for future activities and improvement plans.
Okay, great. And can I call the customer service?
Yes, so I'm assuming that, so our call center, our customer call center is always available. So you can find that phone number on the back of your member ID card. I know that, internally there have been, again, a bunch of improvement efforts, specifically with the call center team, so that they are better trained and equipped to help you with whatever concerns or questions that you may have. So again, if anything comes up with your care, thoughts, questions, concerns, that call center phone number on the back of your ID card will be the great first step in inquiring.
Okay, great. And what steps do you take to make improvements?
Great question. So I think it depends on the specific CAHPS measure domain that we're looking at. So that slide I had just on the different CAHPS measures, whether it be, getting timely care and appointments or customer service. For example, if we're working with an improvement project with a specific team, we'll definitely collaborate with them so that we have all the appropriate stakeholders at that planning meeting to best address your needs. And working with the appropriate stakeholders, having an improvement plan in place, and making sure that it is progressing throughout the year. So it depends, but I think it's the specific activity depends on the domain, but we try to focus on those list of CAHPS measures that I had listed a couple slides back.
Okay, perfect. And do you communicate with providers and share results with them?
Yes, we do. So we do try and we actually do share our CAHPS results, not only internally with stakeholder departments and partner departments that we work closely with, but also provider offices as well, especially our big provider groups. We want to make sure that they are communicated. So we do meet quite regularly, not only our team, our CAHPS team, but other teams throughout the organization. So we make sure to leverage those meetings and bring each year's results to those provider groups to give them a sense and, keep them in a loop of what really matters to their members so that the results can help shape their improvement efforts for the upcoming year as well.
Okay, perfect. Thank you for answering all those questions. And please, participants, if you have any more questions, go ahead and chat me your questions. And at the end of the presentation, I'll check the chat box again. And then, there's one more question. What kinds of things have you discovered really matter to customers?
Great question. So I think it varies with the different product lines and age ranges, but I think holistically for our members, I think what really matters to members is that they're just getting the correct care that is needed for them, and that they're being listened to by their providers. So I think communication is really key. And so I know, internally here at HealthNet, as well as our provider partners, we're really working to streamline those processes and just make sure that member experience is positive at every interaction, whether it be calling the health plan call center, whether it be checking in at your providers, checking in at the front desk at your doctor's office, the time you have to wait to get seen by your doctor. All these interactions, collectively play a part into member experience. So again, it's hard to pinpoint just one, but I think overall, we want to make sure that every member or patient touch point is positive for the member or patient.
Great. Thank you, Ashley.
If I could add one thing to that as well.
Sure.
I think that another important thing that we're looking at throughout the organization is really about transparency about changes and trying to minimize those changes, specifically around tier drug changes or provider network changes, benefit changes. So that is another area that I think is important across products and vary slightly for each product. Thank you.
Okay, great. Thank you for that additional information. I'm just going to check one more area here. If somebody had an issue and they are unable to receive a refund, how can they get help?
So I'll take this. This is Ashley. So to whoever's question that is, I'm sorry you had to experience that. So I would again, suggest that particular member call the call center. So just, the call center is equipped to, look up your, care history and your particular account to really dive deep into the issue. And so they'll be able to get the details and be able to connect to the correct department to help resolve that.
Okay, great. Thank you. Hopefully that will help. Let's go ahead and move on, Ashley, to the next slides. And then if any more questions come through the chat box, I'll go ahead and ask you at the end of the presentation. So now on this slide here, it's focusing on the My Strengths program. My Strengths is a mental health, behavioral health program that is available online or through an app on your smartphone. And there are programs on stress, anxiety, depression, substance abuse, COVID-19, PTSD, there's a pregnancy and early parenting program, and more. There are many programs right at the tip of your fingers. And it is free for HealthNet members. And please check it out when you log into healthnet.com. Next slide, please. So it's a new year, fresh start. We do have telephonic support to help you tackle any new health goals that you may have. A telephonic health coach can help you prioritize your goals, strategize a plan, and support you through your journey. Again, no cost to members. And as a HealthNet member, you also have access to our nurse advice line. The number is right there on your screen, 1-800-893-5597 if you have any questions for a nurse. Next slide, please. All right, thank you. So members can find wellness programs and other resources when you log into your HealthNet account. So you have access to your personal health record, your health risk questionnaire, and programs on weight management, nutrition, exercise, tobacco cessation, type 2 diabetes management, and more. I really encourage you, since it's the beginning of the new year, to complete that HRQ, the health risk questionnaire. It might take you about 15 to 20 minutes to complete. There are many questions, but it really gives you a clear snapshot of your health status once you complete your HRQ, and it will prompt you into certain programs that may be beneficial to you. So please, I encourage any HealthNet members out there to log in and check out the Wellness Center that houses all of these wonderful programs. Next slide, please. All right, healthy discounts. So as a HealthNet member, you also have access to healthy discounts to Weight Watchers, Jenny Craig, fitness centers, or fitness clubs, eye care, hearing and screening. There's so many discounts. So again, you can find all of those discounts on our website at healthnet.com. Next slide, please. Okay, so please mark your calendar and join us next month on February 17th for Keep the Beat, Live Heart Healthy webinar. We will provide a list of the most important numbers to keep track of for a healthy heart. We will explain how to keep those numbers within a healthy range. And you'll also learn how health numbers can positively be impacted with a healthy lifestyle. So I hope you join us in February. Next slide, please. Okay, and we'd like to thank you all for your time today. I am going to check the chat box one more time. Let's see. Okay, there is a question, Ashley. How do we get the QR code?
Hi, this is Ashley, sorry. I'm not quite sure what they're referring to with the QR code.
Okay, maybe this individual can call the number on the back of their ID card and ask any questions to customer service. And hopefully get further detail maybe on the QR code, what they're referring to. Okay, any last? Okay, they said thank you. All right, I think that is the end of our presentation. Again, thank you all for your time today. We are giving you a few minutes back so you can, hopefully enjoy your lunch or go for a nice walk. And we will see you again in February. Thank you so much for joining us. Have a great day.